Good morning to you and welcome to the On the Go post show with the WKYC morning team here on Facebook and YouTube. I'm Danielle Wiggins here with Maureen, Kyle, Austin Love, Dave Chadowski, and our birthday girl, Holly Strano. So let's first off start saying happy birthday to Holly. We've been doing it all morning, but just in case you are joining us, you can also say happy birthday to Holly as well as Jasmine Monroe, who gets the gift of her birthday of having the day off. So how are you enjoying your birthday so far, Holly?
You guys are so sweet. I love you. I had cake for dinner last night on my birthday eve. It's a true story. And I'm going to continue eating sweets like Elf throughout the day.
Oh, very good. Very good.
Yeah.
We love it. Oh, but unfortunately, on your birthday, Holly, we are hearing the news that Ohio has hit the positivity rate of 15%. Right now, the Department of Health has us our 7-day positivity rate at 15.1%, which means that we are now on that travel advisory list. So if people travel to and from Ohio, that means that they should self-quarantine for 14 days. And interesting about that, that also means that if you travel within the state, you are recommended to self-quarantine for 14 days. Now, we also are continuing on conversation with COVID-19 from yesterday. We talked about the vaccine, how the UK has approved Pfizer's vaccine. And we're looking at now the timeline here in the States. And so, Austin, you've been on that story all morning long. What's the latest with our timeline here of when we could see a mass distribution of that vaccine?
Yeah, absolutely. So specifically here in Ohio, Governor DeWine came out and said that we can expect the first doses, the first round of vaccines to be here in the state of Ohio around December 15th. So just in a couple, about a week and a half or so. But and then this month, currently, 40 million doses could be available. And then so each person needs 2 doses of this specific vaccine. So about 20 million people could be vaccinated by the end of the year. And the first people that are going to be, we've talked about this, is the healthcare workers, and then followed by that, the CDC says it's going to be nursing home residents. So followed by that, going down the timeline, is by February and March, the next priority groups could get it, and it's likely going to be those over the age of 65, people with medical conditions, and also essential workers. So if you don't fall into one of those categories necessarily, you're looking at a timeline of April, May, and June of when the public can start receiving these vaccinations. And there's an article on our website, wkyc.com, where it talked about a recent study saying that Ohioans are some of the most likely in the country to be open to getting a vaccine. There's a lot of skepticism surrounding vaccines. Is it safe? And rightfully so. This is a brand new vaccine, so people are rightfully skeptical of it. But apparently Ohioans, due to this study, are the most likely. They're in like the 25th percentile or something like that of being open to taking it right now. So yeah, just a lot of good news here, because once we get this vaccine, hopefully our lives can start looking more normal.
Yeah, and that's really what we're trying to get to. But again, people are cautious. A number of you were still commenting after the post show about whether or not you would get the vaccine. And most of you said no, but some said yes. But Maureen, you saw a study that shows that we have actually been kind of not doing our due diligence in terms of making sure that we're doing everything possible to not spread the virus.
Yeah, I want to make sure I attribute the right study, but basically it was saying that, we let up, this was risky behavior increased this summer and stayed high. This was on NPR yesterday. Basically, we loosened up over the summer. And if you think back to how you were acting and how you were moving about your circle back in the spring, we were really shut down and locked down. Obviously that's controversial, but we were taking extra precautions and the numbers were lower. Then everybody seemed to loosen up during the summer, going to stores, and out to restaurants maybe and sitting on that patio. But the problem is that we've kept that trend through the fall as the numbers started to get higher, as people started going indoors. And the reason I bring this up is because the coronavirus task force is recommending everyone, especially over the age of 65, to go back to the way you were acting back in the spring by ordering groceries. Don't go anywhere indoor where people might not be wearing masks. And it's just risky right now for anybody within that age group and high risk group to be loosened up in any way, shape, or form. And it's something, I don't know, do we do that too? Anybody under the age of 65? Should we be acting that way? Should we be taking a look at how we acted back in the spring and adopting some of those behaviors again, because the weather is forcing people inside, and it's the cold and flu season, and we know viruses spread easier when we're all locked up inside. So like personally, the reason I text this up to all of you, I think about my own experience, and I was ordering groceries, having them delivered. And then I loosened up over the summer, and now I'm headed to the grocery store, and now it's, with kids, you forget the apple juice, and then, then I have to run back to the store, or all of a sudden we're out of milk. So I think it's one of those questions, our audience here on Facebook Live would be interested in talking about. Should we go back to that lockdown mode? That was when we were really figuring out a lot of things with this virus. Now we know a lot more, but again, the coronavirus task force, so this is the federal task force, is recommending people within that older age group to adopt some of those behaviors again.
Wow. So I see some of you guys already commenting here on this post. Jill, she says, it's bad when you normally go into the hospital to get the blood work done, and the doctor you are supposed to see at that same hospital calls to make your appointment virtual. Not going to get that blood work done for right now. And so Alan Huff, again, the continuation on if we will get the vaccine, because as Austin said, that story that we have right now on WKYC.com says that, Ohio, we're more likely to get vaccinated. We're actually, in terms of vaccination, at the 25th. And so he says, no, thank you. As Alan Huff, a vaccine pushed through this fast is not safe. And going back to what Maureen is saying about letting up on the safeguards, I have to admit too, you kind of got like, oh, it was nice. And so you're going outside in the summertime. And actually, my family kind of let up. So not really let up, but just started going more places, still wearing our mask and trying to keep 6 feet social distance. But then my son, he had to be quarantined because he was exposed. And ever since then, I have to be honest, I've pretty much locked my family down. So how have you guys handled everything?
I think maybe the biggest is that, my circle is basically my girlfriend, my photographer, Tim, and those are the ones that I come into most close contact with. and that's about, especially in the past 3-4 weeks, and for sure I think along the same sentiment, I let up in the summer, not completely, but I'm still was going to restaurants, and I still go to restaurants, but I'm not going to go to different places that I don't feel safe at. There's been numerous times where my girlfriend and I have been like, all right, let's go here and whatnot, and then we kind of look inside, I was like, maybe not the best call. And especially around Thanksgiving, we canceled Thanksgiving. I was supposed to go to Indiana to see my parents. I haven't seen them in a while. So especially because my mom's high risk. So, keeping that common sense as well is what this is all about, and staying safe as best as possible.
And that vaccine is supposed to, according to DeWine, the first batches is supposed to come to the state December 15th. We found that out. And Nina, she says she will definitely get the vaccine when it's open for us to get it, because, pretty much piggybacking sort of on what you're saying, Austin, she misses seeing her parents. So you haven't been able to see your parents, Austin, because they're out of state. Your mom is high risk, as you said. PJ, he says that, or he or she says, it's so sad that our healthcare is begging and pleading with us to stay home and wear masks. They are tired. And that's one of the things too, that we are also dealing with, is just the fatigue of healthcare workers and wanting to make sure that they are able to battle this pandemic as well. Holly,
I'll jump in.
Yeah, go ahead.
Okay. No, go ahead.
No, Dave, it's you got the floor. The floor is yours.
I like
What's
to
up,
sit
Dave?
back and let everyone get their word in, let it marinate, and then I'll jump in with my thoughts.
I've
strategy,
been
Dave.
away, so I don't even know what you were talking about. I was doing radio.
Yeah, so you can help Holly out here.
Well, so we were talking about the would you get the vaccination, and we talked about that a lot yesterday. And I don't know if you mentioned it already. I was a little bit late here, but 42% adults from a study said they would not take the vaccine.
Mm-hmm.
So that kind of, it's an interesting number. Yesterday, it seemed as though most people, Danielle, that you had talked about, would not take it. But I think when it comes down to a couple of things, there's two things to think about. Number one, do you feel you are at risk of getting the coronavirus? And then your obligation as a human being to try not to spread the coronavirus. So those are a couple of things to think about. And whether we had the lockdown, now we don't have a lockdown, we have guidelines. And right now, Ohio and Austin talked about that. We're at 15% now. And I think one thing I'm happy to see is that we have always known who is most at risk. Even back before this all started, they pretty much warned us who was at risk. And I think through this whole process, they've talked about masks and social distancing, and that has never let up. But I was really happy to see this morning and reporting that the coronavirus task force warning people that are at high risk and who are older have to even be more cautious. And I think that message needs to be portrayed more. And I'm glad to see it out there, because I think I don't know if it was portrayed as much for a while as we kind of laxed over the summer. That's my opinion.
Yeah, so Holly, we'll close with you. If you have anything to add, you can pass the ball. I'll
just say this, and we had brought this up. I don't know if it was before Thanksgiving that we were talking about how, at least the Northeast Ohio world, and Dave, you might have brought this up. Maybe this is what I'm thinking about. Just seems like normal when you're driving around. And yesterday I had an errand to run, and it was the same thing. I thought, wow, parking lots are jammed, stores are crowded. And then coming in this morning and seeing that we're at 15%, and if you travel even within Ohio, you have to quarantine. Well, we can take that to another level. If you're going to the grocery store, if you're going to, you don't know who you're interacting with, is the truth of the matter. So it's serious. And we're at that point. And I totally agree with what Dave said. It's a matter of, who you're protecting. And I think that we all have those loved ones in our circle that, we don't want to get this. We don't want to get it either, but the people that are highest risk. I think of my grandfather, I think of my parents. It's what we're all doing.
So we are going to, of course, continue this conversation with all of you. Thank you for all of you who have chimed in, and actually everyone watching. We end with Sharon Derrick, who says, I work at Walmart. It's trying and it's hard trying to stay safe. I am a cashier. So we hope that everyone stays safe. And again, a number of people saying happy birthday to you, Holly.
Oh, thank you very much.
And you can catch
happy birthday
Holly and Maureen on the Today Show, and we'll be right back tomorrow, 4:30 a.m. on Go. Happy birthday, Holly. Happy birthday, Jasmine.
And Jasmine, don't forget Jasmine. When I'm not on the Today Show, I'll be eating cake.